My name is Dr. Saif Ahmad. I'm a clinical academic at the University of Cambridge and a consultant clinical oncologist at Cambridge University Hospitals. Primarily, I treat breast cancer patients with chemotherapy, radiotherapy, but I also manage all cancer patients receiving treatment in terms of their side effects and toxicities, and I have a number of regional and national positions in the UK supporting that. The types of patients that I see every day are increasing in complexity, in fact. So cancer, the incidence is increasing. It's affecting both younger people more frequently, but also we're treating more and more older individuals who might have other medical conditions as well, with treatments such as chemotherapy, radiotherapy. And actually, the treatments that we have to offer are becoming more complex as well, including immunotherapy, and in other conditions we're also using CAR T-cell therapies. So in general, the treatment of cancer and what patients need to go through is becoming more complex. So as these treatments become more complex, we are seeing that patients have to manage a wide array of side effects and complications as well. And these side effects are really important because we want them to be manageable for patients so that we can continue the treatment, so that we're able to cure patients or prolong their life in terms of their cancer therapy. And there's a big impact that side effects can have in our ability to give treatments. And actually, the worst case of that is some side effects can be very fatal for patients. And sadly, conditions such as sepsis due to infections are more likely in cancer patients because our treatments suppress the immune system. And so conditions such as neutropenic sepsis kill people across the UK every single day, sadly, and they're associated with a number of other complications and coming into hospital, delays to treatment. So the better that we can manage these conditions, it has a huge impact for patients and improving their clinical outcomes. What we typically see with patients is that they'll be at home when they're receiving their treatments. And so often they'll be calling in with side effects or complications. And that leads to a lot of decision making that we need to do in terms of how those patients can manage things at home or whether they need to come into hospital. And invariably, many patients do come into hospital because of their side effects and symptoms such as infection or other things. And when they're in hospital, we really want to be able to make a quick decision as to what's going on with them, how do we treat them, and a really important decision is whether they need to come into hospital or not. So a typical complication might be something such as febrile neutropenia, which means that we're worried that a patient who's having a fever at home, also their immune system is down, neutrophil cells, which normally fight bacterial infection, are suppressed because of the chemotherapy, and that can be life-threatening. Actually, it can lead to death rates of around 10%. And so we want to get these patients into hospital as quickly as possible to treat them with antibiotics, which can be life-saving for them. However, we also know that a number of individuals who are at home, who have a fever, feel unwell, they're actually not exposed to this condition and aren't really at risk of a poor outcome. And so for them, giving them antibiotics when they don't need it can actually have its own downsides. For instance, it can lead to side effects such as diarrhea, and most importantly, it can also lead to antimicrobial resistance, both within that patient, but wider from a societal point of view. And why it's particularly important in cancer is that these patients are often on treatment for a long time. These episodes will happen multiple times. And so, because we might be treating them with inappropriate antibiotics a number of times, that further increases the risk of antimicrobial resistance. Diagnostics in these cases is critical because we want to know what we need to do with these patients, and we really want to know the answers as quickly as possible. So what we want from our diagnostic test or platform is that we get a fast result, but we also get a really accurate result, and a result that has a direct impact on the decision we're going to make. So for instance, in the context of infection, we can understand the type of organism that's causing the symptoms that a patient has. For instance, even know if it's a viral condition versus a bacterial condition, that can be critical in terms of understanding, does this patient need antibiotics? And in the case of potentially a mild virus, we could potentially send these patients home with the appropriate support. So really the key for us in terms of diagnostics is to get a fast, accurate result that we can act on immediately. The burden of AMR is only going to increase in the context of cancer therapy. Right now, it is a problem for patients, and we know from studies in the literature that cancer patients tend to have greater rates of AMR compared to the average population. But as we treat individuals for longer and longer, and as AMR rates increase within the wider population, this will leave us with a real challenge where we're not able to treat individuals with cancer for their infections, which will have a hugely detrimental impact on their outcome. So we're really at a crossroads in terms of how we manage our patients in the context of antimicrobial resistance and infection in cancer. And it's really exciting that there's a lot of technologies being developed that offer the opportunity that we'll be able to better manage patients in future. So be that drug discovery and potentially powered by AI that can lead to new antimicrobials that can better serve our patients. Be that in terms of vaccines as well, that means that individuals are less likely to develop the infections. And all of this needs to be underpinned by strong diagnostics so we can identify diseases more quickly and more accurately so that individuals can get the right treatment at the right time. So looking ahead to the future, we know that healthcare systems are constrained in terms of financially and in terms of resources in general. But everyone is really focused on improving the outcomes for patients, and everyone is really focused on ensuring that challenges such as infection, antimicrobial resistance, do not lead to healthcare systems in the future where patients are essentially unable to be managed. And so in terms of looking ahead, we really need to build solutions that can come into the day-to-day clinical practice. And that means that these solutions need to be cost-effective and work within that constrained environment in terms of finances. And so it's important that we innovate not just for the problems of today, but for the problems of tomorrow, to ensure that cancer patients and patients throughout the healthcare system are receiving the best and most innovative solutions to ensure that the clinical outcomes are the best that they can be.